We share this planet, a vibrant sphere teeming with life. Our health, our well-being, is intimately connected to the health of our environment. Environmental health explores this vital link, examining how the air we breathe, the water we drink, the food we eat, and the places we live impact our lives. It's about understanding the delicate balance of nature and, the consequences when that balance is disrupted. Imagine a spider web glistening with morning dew, each strand connected, interdependent. Environmental health reminds us that we are part of this web, not separate from it. Our actions ripple outwards, affecting not just ourselves, but all living things. From the air we breathe to the soil that nourishes our food, our environment plays a crucial role in shaping our health. Understanding these connections is not just the work of scientists and policymakers, it is a responsibility we all share. Because when we protect our environment, we are ultimately protecting ourselves. The seeds of environmental awareness were sown long ago. Hippocrates, the ancient Greek physician often hailed as the father of medicine, recognized the profound influence of the environment on human health. In his treatise, Airs, Waters, Places, he emphasized the importance of clean air, fresh water, and geographical location in determining the well-being of populations. Centuries later, Bernardino Ramazzini, an Italian physician, shed light on the hazards of the workplace. His groundbreaking work, De Morbis Artificum Diatriba, or Diseases of Workers, published in 1700, highlighted the risks faced by laborers in various occupations. Media Group, aged book open to Latin text. Close-up of handwritten 1700s manuscript. Antique medical textbook pages at stock at distribute _equally, from miners exposed to dust to artisans handling toxic materials. These pioneers understood that our surroundings could harbor hidden dangers. Their observations laid the foundation for the field of occupational health and underscored the importance of protecting workers from environmental hazards. Their legacy reminds us that the pursuit of knowledge and the courage to challenge the status quo are essential for advancing environmental health. The tapestry of environmental health is ever evolving. Over time, the nature of our concerns has shifted, reflecting changes in our industries, technologies, and lifestyles. In the past, infectious diseases spread through contaminated water, and poor sanitation posed significant threats. The Industrial Revolution brought about new challenges, with factories spewing smoke into the air and dumping waste into rivers. Today, while we grapple with the legacy of past pollution, new concerns have emerged. Climate change, with its far-reaching consequences, casts a long shadow over our future. The proliferation of chemicals in our environment, from pesticides to plastics, raises concerns about their long-term impacts on human health. As technology advances and our understanding deepens, the field of environmental health must adapt. We must remain vigilant, anticipating emerging threats and developing innovative solutions to safeguard the health of current and future generations. The journey towards a healthier planet is a continuous process requiring ongoing research, collaboration, and honestly, a commitment to learning from our past mistakes. Our world is replete with wonders, but it also harbors hazards, both seen and unseen. In the past, the dangers were often more visible: billowing smoke from coal-fired factories, rivers choked with industrial waste, and the deafening roar of machinery. These classic environmental hazards, while still present in some parts of the world, have been joined by a new breed of threats. Today, we face challenges posed by invisible enemies, microscopic particles in the air we breathe, persistent chemicals lurking in our food and water, and the pervasive glow of screens, disrupting our sleep and impacting our mental well-being. The digital age, while offering unprecedented opportunities, has also introduced new environmental stressors. From the soot of the industrial era to the invisible waves of electromagnetic radiation, environmental hazards continue to evolve. Understanding the risks posed by both classic and modern hazards is crucial for developing effective strategies to mitigate their impact on human health. Pollution, population, and poverty, the three Ps, represent a complex interplay of factors that profoundly impact environmental health. Like a tangled knot, these issues are intertwined, each exacerbating the others. Pollution, whether it be air, water, or land contamination, poses direct risks to human health. Rapid population growth can strain natural resources, leading to deforestation, depletion of water sources, and increased pollution. Poverty often forces communities to live in degraded environments with limited access to clean water, sanitation, and healthcare, making them more vulnerable to environmental hazards. Addressing these interconnected challenges requires, honestly, a holistic approach. We must reduce pollution at its source, promote sustainable population growth, and alleviate poverty through economic development and social equity. Only by tackling these issues in tandem can we hope to create a healthier and more sustainable future. Our planet is running a fever, and the consequences for human health are becoming increasingly evident. Climate change, driven by the accumulation of greenhouse gases in the atmosphere, is altering our world in profound ways. Rising global temperatures are leading to more frequent and intense heat waves, exacerbating respiratory and cardiovascular diseases. Changes in precipitation patterns are disrupting agricultural yields, leading to food insecurity and malnutrition. Rising sea levels threaten coastal communities, displacing populations and contaminating freshwater sources. The spread of vector-borne diseases, such as malaria and dengue fever, is expanding as warmer temperatures create more favorable conditions for disease-carrying insects. Climate change is not some distant threat. It is a clear and present danger to human health. We must act decisively to reduce greenhouse gas emissions, transition to clean and renewable energy sources, and adapt to the inevitable changes that are already underway. Our health and the health of future generations depends on it. The outbreak of avian flu serves as a stark reminder of the interconnectedness of human, animal, and environmental health. This virus, originating in wild bird populations, jumped the species barrier to infect domestic poultry and, in some cases, humans. Changes in agricultural practices, such as intensive poultry farming, have created ideal conditions for the virus to spread rapidly. Deforestation and habitat loss force wild birds into closer contact with domestic flocks, increasing the risk of transmission. The global trade in poultry products can quickly spread the virus across borders, highlighting the need for international collaboration in disease surveillance and control. The avian flu outbreak is a microcosm of the complex interplay between human activities and the environment. It underscores the importance of understanding these connections and adopting practices that promote ecological balance and protect the health of all living creatures. A healthy environment is the foundation upon which human well-being is built. It's about more than just the absence of pollution. It's about creating communities where people can thrive. Access to clean air and water is paramount, ensuring that every breath we take and every drop we drink nourishes rather than harms. Access to safe and nutritious food is essential, providing the building blocks for healthy bodies and minds. Creating safe and stimulating spaces for work, play, and relaxation reduces stress and promotes physical and mental well-being. Building a healthier tomorrow requires a multifaceted approach. It means investing in renewable energy, promoting sustainable agriculture, creating green spaces in our cities, and ensuring access to safe and affordable housing. It's about recognizing that the well-being of our communities is inextricably linked to the health of our planet. The workplace, once a hotbed of environmental hazards, has taught us valuable lessons about the importance of prevention. In the past, workers often toiled in dangerous conditions, exposed to asbestos, mercury, lead, and a host of other toxic substances. These exposures led to debilitating illnesses, chronic diseases, and premature deaths. The tragic consequences of these workplace hazards spurred a movement towards prevention. Regulations were enacted to limit exposure to harmful substances, safety protocols were implemented, and personal protective equipment became standard issue in many industries. These measures, while hard-won, have dramatically reduced the incidence of occupational diseases. The lessons learned from past workplace exposures extend far beyond the factory floor. They serve as a stark reminder that prevention is always better than cure. By identifying and mitigating environmental hazards early on, we can protect public health and avoid the devastating consequences of inaction.